From this, we get to understand that we are approaching an era of the mechanistic understanding of medicine, where we are going from Renaissance to Enlightenment. Sorry. After centuries of dogma, Renaissance revived anatomy and experimentation. For example, the thinker Vesalius contributed towards correcting Galen's anatomical errors, and his influence was that observation must replace authority. William Harvey discovered circulation of blood, and based on that, physiology was gained a massive point about thinking about dynamic systems. René Descartes said body as a machine, and this led to a mechanistic model of disease. And then we have Thomas Sydenham, who was the English Hippocrates. He classified a lot of diseases in a way which basically become pattern-based disease taxonomy. You might have probably heard about René Descartes. He said something along the lines of cogito ergo sum, which means I think therefore I am. I read about this on my 7th class textbook many years ago. Yeah, I'm very old, guys. And we were talking about the other guy. Sydenham was nicknamed the English Hippocrates. He was a well-respected doctor in England, and he was known for telling young doctors that you must go to the bedside. It is there alone that you can learn about the disease. He had emphasis on noting down the symptoms and making sure that a full history of the patient's health and symptoms was taken so that correct diagnosis could be placed. He believed that disease was like plants and animals, that they could be organized into different groups. He went against the ideas of the four humors which we discussed earlier, and believed that the disease was personal to the patient depending on the stars, weather, diet. He caused progress in medicine by making detailed description of many illnesses, including the first description of scarlet fever. He also believed in allowing the body to fight the illness on its own, rather than bleeding or purging, which would have been extremely painful. This beautiful dance that you see is the Sydenham's chorea, which is also known as Saint Vitus dance or Saint Johannes chorea or chorea minor or rheumatic chorea, is one of the major clinical manifestations of acute rheumatic fever, and is one of the most common form of acquired chorea in childhood. It is a movement disorder characterized by chorea, emotional lability, and hypotonia. It is it is still a common manifestation of rheumatic fever, and one of the common symptoms that occur in rheumatic fever. So this again leads us to what is rheumatic disease, right? So you can look at this thing called the Duckett-Jones diagnostic criteria, which talks about the major parts of the syndrome, which include carditis, arthritis, subcutaneous nodules, erythema marginatum, and Sydenham's chorea, and minor criteria, which would include fever, raised ESR, CRP, arthralgia, prolonged PR interval, and previous RF. For there to be an evidence of the infection, you need 2 major or 1 major plus 2 minor of the fact. So the shift here, which we observed, was that observation became related to the mechanisms. Clinicians began asking how does it work rather than why does it happen. The reasoning style was anatomical and mechanistic logic.